Hello, everyone. Today, we are going to explore a very important topic that not everyone realizes has such a huge impact on health, especially for older adults: vitamin D and calcium. Did you know that with just these little nutrients, we can transform the quality of our lives? Just imagine when we have enough vitamin D and calcium, our body works stronger, our joints no longer ache, and we can enjoy life comfortably without worrying about health issues. Surprising, right? However, not everyone knows that as we age, our bodies are more prone to deficiencies in these two nutrients, leading to serious health problems such as osteoporosis, fractures, or weakened immune systems. This can make us feel tired, in pain, and not as lively as before. But don't worry, today we are going to explore the wonderful benefits of vitamin D and calcium and how to include them in our daily diet. Believe me, when you start paying attention to these nutrients, you'll feel your body change in a magical way. If you or someone you know is entering their later years, don't miss this video. Let's discover how these small things like vitamin D and calcium can lead to such significant changes. And if you're wondering why vitamin D and calcium, let me help you find out right now. I promise you won't regret it. We often hear about vitamin D, but do we truly understand its significance for our health? Especially for older adults, vitamin D is an essential companion that helps maintain a healthy and vibrant life. But why is this the case? Let's explore it together. Did you know that vitamin D is one of the most essential vitamins for our body? We can get vitamin D from sunlight, food, or supplements. However, for older adults, absorbing vitamin D from sunlight becomes more difficult as we age because our skin's ability to produce vitamin D decreases with age. Even when we do go outside, older people often get less sun exposure for various reasons, such as poor health, lack of movement, or fear of sun damage. This leads to a deficiency in vitamin D, which is not something to overlook. Vitamin D plays an extremely important role in the body, especially in bone health. Did you know that vitamin D helps the body absorb calcium effectively? This is crucial because calcium is the primary component of strong, healthy bones. If you lack vitamin D, no matter how much calcium you take, your body will not be able to absorb and use it efficiently. This is why older adults with vitamin D deficiency often experience bone issues such as osteoporosis, fractures, or joint pain. What might surprise you even more is that vitamin D has a very special effect on the immune system. When the body lacks vitamin D, its ability to fight off diseases decreases significantly. This becomes even more critical for older adults, as their immune system naturally weakens over time. Adequate vitamin D intake helps boost the immune system, reducing the risk of infections and chronic diseases. Furthermore, vitamin D helps maintain a healthy heart. Studies have shown that those who are deficient in vitamin D have a much higher risk of cardiovascular diseases. Isn't that just amazing? But wait, there's more. Vitamin D also helps maintain a positive and cheerful mood. A healthy body and heart mean a healthier mindset. This is especially important for older adults who often face health-related psychological challenges. Proper vitamin D supplementation can improve quality of life. A lack of vitamin D can lead to fatigue, anxiety, and even depression. However, when vitamin D is supplemented sufficiently, the body becomes more energetic, the mood becomes more optimistic, and life becomes more meaningful. So how can we ensure older adults get enough vitamin D? In addition to increasing sun exposure, we can also get vitamin D from our daily diet. Fatty fish like salmon, mackerel, and tuna, eggs, milk, and dairy products are all excellent sources of vitamin D. However, if the body cannot absorb enough from food, vitamin D supplements are a great solution. But it's important to consult with a doctor to determine the right dosage and avoid excess intake. We cannot deny that vitamin D is a golden key that helps older adults maintain better health and enjoy a long, energy-filled life. Take care of yourself and your body with more attention so that every day becomes a day full of joy and health. Surely we have all heard many times about calcium, the essential mineral that our body can't do without, especially for older adults. However, did you know that calcium is not only necessary for maintaining strong bones, but it also affects many other crucial functions in the body? This might surprise you because many people only associate calcium with bones and don't fully understand all the incredible benefits it brings. Calcium is the most important factor in building and maintaining strong bones and teeth. This is something we all know, But did you know that about 99% of the body's calcium is stored in our bones and teeth? This shows how crucial calcium is for bone structure, keeping bones strong, flexible, and resistant to fractures. However, as we age, our ability to absorb calcium from food or sunlight decreases significantly. This leads to calcium deficiency, which causes serious issues, especially in older adults. Osteoporosis, a common problem faced by the elderly, is a direct result of calcium deficiency. When bones lack calcium, they become weak and brittle, making them more prone to fractures. A minor fall can cause severe injuries in older adults. Therefore, ensuring adequate calcium intake is incredibly important for protecting joints, maintaining mobility, and preventing unfortunate accidents. In addition, calcium plays a very special role in cardiovascular health. Calcium doesn't just maintain bone health, it also plays a crucial role in regulating heart function. Calcium helps keep the heart beating regularly, maintains stable blood pressure, and ensures that muscles, including the heart muscle, work efficiently. Without calcium, our heart wouldn't function properly, leading to heart rhythm disorders or blood pressure problems. Isn't that amazing? Calcium not only helps you have strong bones, but also keeps your heart pumping strong and healthy. Another benefit of calcium that you might not know is its support for nerve regulation. Calcium plays a critical role in transmitting nerve signals, helping your nerves and muscles function properly. When your body is low on calcium, you might feel fatigued, experience muscle cramps, or even numbness in your limbs. Supplementing with calcium helps muscles become more flexible, reduces fatigue, and helps us maintain good health in our daily lives. So how can we ensure we're getting enough calcium, especially for older adults? The answer is quite simple. Milk and dairy products are the best natural sources of calcium. Additionally, dark leafy greens, such as spinach and broccoli, and seeds like chia and flax are also high in calcium. However, if your diet doesn't provide enough calcium, supplements are an effective solution. Just be sure to consult with a doctor before starting calcium supplements to choose the right type and dosage. Remember, calcium is an irreplaceable companion in our health journey, especially as we grow older. With calcium, we can not only protect our bones and joints, but also maintain a healthy heart, flexible nerves, and an overall healthy body. Make sure to give extra attention to daily calcium intake so you and your loved ones can live happily, healthily, and full of energy. As we age, our body doesn't function like it used to, and maintaining our health becomes more important than ever. One of the key factors that help us stay healthy for a long time is vitamin D and calcium. But how can we provide enough of these vital nutrients for older adults? This is a common question, and today we're going to explore simple yet incredibly effective ways to supplement vitamin D and calcium. First and foremost, we can't overlook the importance of sunlight exposure. Vitamin D is naturally produced by our body when we get exposure to sunlight. Isn't it amazing? Just a few minutes in the sunlight each day can help our body produce enough vitamin D. However, this isn't as easy for older adults because as we age, our ability to produce vitamin D from sunlight decreases significantly. But don't worry, even if sunlight exposure may not be as effective as before, we can still supplement vitamin D through food and supplements. Some foods rich in vitamin D that can be added to an older adult's daily diet include salmon, mackerel, tuna, eggs, and milk. These foods not only help supplement vitamin D, but also provide other essential nutrients for the body. And don't forget about vitamin D supplements. This is a fantastic solution to ensure the body always receives the necessary amount of vitamin D, especially for those who can't get enough sunlight. Along with vitamin D, calcium is an extremely important factor in protecting bone health, especially for older adults. If you want a healthy body and strong bones, calcium is an irreplaceable companion. You can easily supplement calcium through dairy products, such as milk, cheese, yogurt, and dark leafy greens like spinach and broccoli. Additionally, chia seeds, flax seeds, and sesame seeds are excellent sources of calcium. However, sometimes our diet isn't enough to meet the body's calcium needs, especially for older adults. At this point, taking calcium supplements becomes a very effective solution. But remember, before using calcium supplements, it's important to consult with a doctor to determine the appropriate dosage for your body. Over-supplementing calcium can lead to unwanted health issues, so it's crucial to control the dosage. Furthermore, it's important to note the synergy between vitamin D and calcium. Vitamin D helps the body absorb calcium more effectively, so when supplementing calcium, make sure your body is getting enough vitamin D to optimize calcium absorption. This is why supplementing both vitamin D and calcium in your daily diet is so important. It helps maintain healthy bones, keeps you flexible, and prevents bone-related diseases. Isn't it amazing that just by making small changes to our diet and daily habits, we can help older adults maintain their health and live happier lives? Don't wait until health starts to decline. Start now to take better care of your body every day. When we start focusing on supplementing vitamin D and calcium, you've probably heard a lot of advice on how to use them to protect your health, especially for older adults. However, did you know that using these two nutrients isn't always straightforward? If you're not careful and pay attention to a few important points, you may face unwanted side effects. So today I want to share with you some key points when using vitamin D and calcium to ensure that you get the maximum benefits without any negative effects. First, you need to understand the proper dosage. While vitamin D and calcium offer numerous benefits, taking too much of them can have negative consequences. For example, if you take too much calcium, it can cause constipation, stomach pain, or even kidney stones. On the other hand, excessive vitamin D intake can lead to toxicity with symptoms like fatigue, nausea, or high calcium levels in the blood, which can lead to heart issues. Therefore, when supplementing vitamin D and calcium, it's essential to consult with a doctor or a nutritionist to determine the right dosage for your body. One very important point that not everyone notices is the relationship between vitamin D and calcium. Vitamin D and calcium are closely connected. Vitamin D helps the body absorb calcium from food or supplements effectively. If you're deficient in vitamin D, your body's ability to absorb calcium will be impaired, no matter how much calcium you consume. This is why it's essential to ensure you're getting enough both vitamin D and calcium in your daily diet to help your body absorb and utilize them properly. Another crucial consideration is the timing of supplements. While vitamin D is best absorbed when the body is exposed to sunlight in the morning or afternoon, you can also supplement vitamin D through food or pills. However, to optimize its effects, it's best to take vitamin D in the morning or afternoon, as this is when the body is most efficient at using it. Taking vitamin D in the evening might cause sleep disturbances or insomnia. Additionally, when supplementing calcium, pay attention to the calcium content in each food. For example, milk is an excellent source of calcium, but if you're not drinking enough milk, you could still end up with a calcium deficiency. Especially for older adults, the digestive system may not absorb calcium as effectively as it did when they were younger. Therefore, you need to add other calcium-rich foods, such as leafy greens, seeds, or take calcium supplements to ensure you're getting enough for your body. Another point you can't overlook is regular health checkups. Checking your vitamin D and calcium levels will help you know if you're deficient. This is especially important for older adults, as the body may lose its ability to absorb and utilize these vital nutrients. If you show signs of deficiency, you should adjust your diet and supplements accordingly, under the guidance of a doctor. Finally, remember that vitamin D and calcium are essential companions in your health journey. However, supplementing them requires a plan and proper guidance to ensure the highest effectiveness. Take care of your body, love it, and follow these important tips to stay healthy and full of energy at every stage of life. When we talk about the health of older adults, we can't overlook vitamin D and calcium, two incredibly important elements that are often neglected. But did you know that simply supplementing these two nutrients correctly and adequately can provide powerful support for the body, leading to a healthier life full of energy and vitality? Isn't it surprising? Just imagine, with a little attention to supplementing vitamin D and calcium in the right way, we can significantly reduce bone and joint problems, enhance the immune system, and help the body maintain flexibility and strength. Especially for older adults, when bones are no longer as strong as before, supplementing vitamin D helps improve the absorption of calcium from food, keeping bones healthy and reducing the risk of osteoporosis or fractures. And the best part is that vitamin D also supports the cardiovascular system, keeping the heart healthy and preventing heart-related diseases. In addition to these remarkable benefits for bones and the heart, vitamin D and calcium can also improve mood and the quality of life. A healthy body creates a positive, cheerful spirit. Just think about it. When we feel strong without pain or fatigue, we are more motivated to engage in activities we love, socialize with friends and family. Our lives will be so much more meaningful, right? However, supplementing vitamin D and calcium is not a magical solution. It needs to be done properly and scientifically. You need to know the exact dosage required and combine it with a balanced, moderate diet. Don't forget that our bodies cannot produce enough vitamin D without sunlight, so proper sun exposure each day is necessary. At the same time, if you feel your diet is lacking, you can certainly supplement vitamin D and calcium through pills. Especially for older adults, it is crucial to consult a doctor before supplementing vitamin D and calcium. The right dosage, combined with nutrient-rich foods and regular health checkups, will help you maintain good health and prevent diseases related to bones, the heart, and other concerns. Remember, health is the most valuable asset, and we need to care for it from the smallest details. We cannot deny that supplementing the right amount of vitamin D and calcium not only keeps the body healthy, but also brings joy and happiness into life. Start now, maintain the habit of supplementing these two nutrients properly, and take good care of your health so you can live long, happily, and full of energy. Don't let age hold back your health. Always cherish your body and take good care of it. Bansu.